Hello, everyone. It's really good to be with you to share some extraordinarily exciting news that I believe will transform the way care is delivered in this country and take the work that we all do for our patients and communities to entirely new heights. And that is that today we are announcing that our organization, Atrium Health, intends to join with Advocate Aurora Health to become one nationally leading system. So let me begin by sharing a little bit about Advocate Aurora and why there couldn't be a better partner for us to create a new future together. First and foremost, Advocate Aurora is the leading employer in the Midwest with 75,000 team members, serving nearly 3 million patients annually in Illinois and Wisconsin across more than 500 care sites. Like us, Advocate Aurora is deeply rooted in a very similar mission that all human beings, teammates, patients, community members alike, should be treated with care, with dignity, and with respect. And they don't just say these words, they actually live them. They're completely aligned with our For All mission, and in fact, together, we will be providing over $5 billion in community benefit to improve access and health in the most vulnerable rural and urban communities across 6 states. Simply stated, together, we will be able to do more, be better, go faster in serving our patients and community as we write a bold new chapter in the unwritten future of healthcare. But I also want to answer the question, why now? And I'm reminded of a quote I grew up hearing as a child that my Spanish mother would say, "No dejas para mañana lo que puedes hacer hoy." Or in English, don't put off until tomorrow what you can do today. You know, but in thinking about our strategic combination, I'd like to alter that statement to be, our future has its eyes on us today, so we can't put off tomorrow. The world of healthcare as we know it is changing. It's more digital, it's more personalized, it's more scientific, it's more complex. And by combining our expertise, our resources, our capabilities across state lines, we are manifesting a new future that will enable us together to thrive so that we can create even more impact for every hand that we hold and every life that we touch. Our patients, our teammates, students, and neighbors will live better and richer lives because we came together as one to serve a combined footprint of 18 million community members. The bottom line is that this is our moment. But it's not just for us, it's for our families, it's for our patients, it's for our neighbors and each other. It is now my pleasure to introduce you to Jim Skogsberg, who is the CEO of Advocate Aurora Health. And Jim and I recently sat down together to chat about our strategic combination and our excitement for the future.
You and I go back a ways,
Yeah.
and tremendous admiration for you personally as a leader. And I've had a chance to see that and experience it over the years, but also your organization. And I know Atrium has a rich history, and we know that, even with your predecessor, and we watched all the great work that was being done at Carolinas, and then you come in and just take it to a new stratosphere. I'll tell you, we have so many things that were sort of similar in terms of our values and our skills and the things that we do so very well, but we particularly admire, and I'm almost hesitant to say this because it's like only 2 or 3 or 4 when there's like 50. But I'll tell you what stands out. Your focus on learning and discovery, outstanding. We love that. Your focus on clinical quality, which mirrors our own. And then I love you guys are great community citizens. And I know together we're going to be great community citizens in all the communities we serve, but we're going to be great citizens of this earth, right? When we talk about sustainability and so on. So love that about you guys, and I think we're so complimentary of one another. It's going to be a great ride.
It certainly is.
So Gene, we've been actually working on this a long time, right? This has been months and months and months in the making. But I think a common question asked by almost everybody is, why now?
I would say a couple of things. One is that, we both are leaders and have organizations that change before we have to. Right? We're not waiting for somebody else to lead. We want to lead, and I think there's no better time coming out of a pandemic. We wanted to come out of this pandemic better, stronger, faster, and you did too. That's part of our original conversation. So we think this is the best time to create the future. But as we've talked so many times, healthcare is changing at a rapid speed that we've never seen before in our 30-plus year careers. And so I think we're really looking to define a new future together. And as we've said, and I've told my team, there's no better partner than Advocate Aurora.
Yeah, thank you for that. Let's talk name and headquarters,
Sure.
right? Because this has been and will continue to be a compromise, right?
Yeah.
Why don't you take name and then I'll talk headquarters,
Sure.
so people hear our particular thought process.
Sure. Well, I've known about the Advocate name for a very, very long time. I mean, it stands for quality, for excellence. But the thing I love about the name itself is, the word. You're advocating for patients, you're advocating for teammates, you're advocating for community. And I think to have that as our system name, I think is going to be awesome. And the other part of it is, as you know, that each of our communities, they will retain their consumer-facing names. So, Atrium Health in the North Carolina and Georgia will maintain that local name as throughout the rest of the system, but then we'll be all, known as Advocate Health. So,
conversely, now headquarters,
yeah.
That's a big deal. Now, one of the things that we've said is, in the last couple of years, we've learned that headquarters, wherever you are with your laptop and your phone, right?
Exactly.
And we've certainly had a ton of remote work, which has made us rethink the whole notion of headquarters. But you got to have one, and the notion that it would be in Charlotte makes perfect sense for a variety of reasons. I mean, the whole energy of Charlotte and the growth market that it has. But more importantly, that's where you are, right? And so as you become CEO of this organization, it only makes sense that it be in Charlotte. And we are so excited to be joining with you and very comfortable with that name, Advocate, and the headquarters, Charlotte. It represents compromise, which is what's going to make this new organization so successful.
Very well said. And I think the other thing is we're going to maintain very, very strong presence in Milwaukee and Chicago and through other communities that we serve. So I think that's going to be part of it as well that I think I'm excited about, because these are incredible communities that we have the privilege of serving. And so we want to make sure we have a very strong presence wherever we are.
Absolutely.
Yeah. So there you have it. I think you get a sense for the chemistry that certainly Jim and I have, but as importantly is how aligned our organizations are, our missions, our values, how we think about the future. And I'm really excited about being on this journey together with Advocate Aurora Health. And there's just so many great things ahead for all of us, and I'm excited to begin the journey.